So here in Baltimore, among the youth, PTSD, post-traumatic stress disorder, depression, there's a high prevalence of both in our youth because of the violence that they experience in their homes and in their communities. And Healthy Minds at Work is an intervention that was created to address that problem. What we did was we provided mental health resources to an already established job training program in hopes that these mental health resources, clinician sessions, group therapy, that they would improve educational and employment outcomes in these youth. In addition to my work with the Center for Adolescent Health through Healthy Minds at Work, I also am involved in research with adolescents in a number of other ways. Most of these projects involve sexually transmitted disease risks among youth. Most recently, I did a project, an agent-based model, in fact, that was able to show that the context in which young women were making decisions about their sexual partners really did matter. In fact, because violence, incarceration is so high in the city, there is a scarcity of young black men. And this scarcity, this lower male to female gender ratio, significantly impacts the choice sets that young women have. And it also is associated, as my model showed, it's associated with riskier partner selection for those young women. There were two important findings so far in our analysis for Healthy Minds at Work. One is we were able to engage young black men in mental health services. There's so much stigma about depression and depression treatment that this is a pretty significant finding that young black men are interested in mental health services. The second thing that we've found so far is that there is an intervention effect for young black men. Between the ages of 16 and 19, the prevalence of employment at 6 months was 2 to 4 times higher among those who were engaged in the intervention compared to those who were not engaged in the intervention. And that's among those who were unemployed at baseline. So the impact of those findings could be applied in a number of ways. But what's really important is that we found that addressing the needs of youth, their mental health needs, can actually put them on a different trajectory in terms of employment and educational attainment. My findings from my previous research on the impact of male to female gender ratios on risky sexual behavior in young women can hopefully be applied to informing the need for youth programs that keep young kids off the street, keep them in schools, keep them out of prisons, so that we can really address the scarcity of black men in their communities.